Hello, and welcome to today's presentation on social work in a library. This is a program proposal intended as a partnership with Community Partnerships of the Ozarks in order to better serve our patrons facing challenges such as homelessness, lack of access to disability resources, and mental illnesses. Especially in the wake of COVID-19, we are well aware of the rising challenges related to housing insecurity and socioeconomic disparities. While as a library, we here at Springfield Greene County Library District do our best to meet the information needs of our patrons. Rising rates of housing insecurities and widening financial gaps between the haves and the have-nots means that the needs of our community have surpassed our library's capacity to provide sufficient service. Additionally, the degree of discrimination those who are unhoused and financially burdened face from the community leads to many who hesitate to reach out for help. Many of those who are in need come through our doors each day. We do what we can, but without someone on staff with the training to handle the nuances of social work, we are limited in our capacity to help our patrons address their needs. To illustrate the degree of socioeconomic disparity our patrons face, note these statistics that compare Greene County to the state and the rest of the nation. With the sole exception of the unemployment rate, which is lower than the rest of the state and the nation, a fact that can likely be attributed to unemployment benefits running out, underemployment, and a cultural sense of embarrassment about asking for help or charity, most likely due to discrimination. One can't help but notice that our county consistently rates higher than the state and the nation in terms of low income levels, percentage of the population below poverty level, and lack of access to basic necessities like affordable health care and affordable decent housing. It is clear that our community needs active social services, and while we do what we can in the library, we are limited. To further demonstrate the growing degree of housing insecurity our community faces, please note the following information from a 2021 KY3 News article about homelessness in Springfield according to the Springfield City Council and CPO. After discussing the far-reaching effects of homelessness and the resulting survival responses of those facing homelessness, such as squatting in empty homes, crime and violence due to stress and fear, and the resulting economic fallout from businesses choosing to leave or not open in Springfield because of these issues, the article emphasizes that there are no easy fixes. The problems are systemic and rooted in inflation with stagnant wages. According to KY3 News, at the end of the day, affordable housing is the real critical piece, said Michelle Durand, the CPO, Vice President of Affordable Housing and Homeless Prevention. Durand said that taking into account the homeless and those who live under the poverty line, we have a deficit of about 15,000 units to be able to house a number of people looking for homes in that income bracket. Councilwoman Heather Hardinger says, people do deserve to exist and live with dignity. It's just a matter of figuring out a solution that fits our community. Community Partnership of the Ozarks, CPO, estimates that there are about 440 households and 750 individuals in Springfield who are currently experiencing homelessness. The library is limited in how we are able to address housing insecurity in our patrons, as we are not social workers. But by partnering with CPO and other local advocacy groups, we can hire a full-time in-house trained social worker who can assist patrons experiencing housing insecurity and other socioeconomic challenges more directly. What all of this comes down to is that while we in the library want to be able to help our community address these needs, we are not equipped to handle them on our own. While the unhoused often take refuge in our libraries, especially the branches located downtown and on the north side of Springfield, and we do our best to treat them with humanity and kindness, understanding the stresses of food and housing insecurity, the needs of the unhoused outstrip our ability to provide support. While we happily provide information about advocacy resources, our reach is limited. According to Waller et al. 2019, Most library staff do not have the training to assess or intervene with complex psychosocial problems. Thus, partnerships could be helpful with social workers or other professionals who have had this training and education. And according to Kanyan et al. 2020, people experiencing homelessness or other life crises often seek respite, information, and assistance in libraries. Librarians, like social workers, are helping professionals and have historically been advocates for and supporters of low-income groups. However, librarians may lack the knowledge, skills, and capacity to provide adequate support. As a result, social workers have become integral to innovative library initiatives, serving low-income and homeless patrons. As the need continues to grow, it's become clear that it's time to take a bigger step toward providing adequate service by budgeting for and hiring a full-time rotational and, most importantly, credentialed social service worker to provide service at our branches that most often face social service needs. This person will rotate between Park Central Branch, Midtown Carnegie Branch, and the Library Station, the three branches with the highest percent of housing challenge patrons, as an on-site representative who can directly connect those in need of various social services with the right resource. While the intention is especially to help those facing housing, food, and job insecurity, this person's reach will also extend further to help those with accessibility challenges, such as the visually, hearing, and mobility impaired in our community, a demographic that is also higher than state and national averages. The role of Social Services Coordinator, as it will be called, will fall under the Outreach Services umbrella. The coordinator will require a publicly accessible but privately partitioned section of the library floor space in each of the primary three branches in which they will work: Park Central Branch, the Library Station, and Midtown Carnegie Branch. The space will need sufficient room for a table or desk and at least 3 chairs, 1 for the coordinator and 2 for the patrons. This space will require sufficient display space for informational flyers and brochures that patrons can take with them. The materials will come from existing furniture in library storage or from bonus funds raised by the Friends book sale. The space should be welcoming and allow for sufficient privacy for consultations. The coordinator will also be required to train staff at each of the locations to field the most common questions and inquiries, so that needs can be addressed when the coordinator is at a different branch. These training sessions should take place biannually and upon hire of new public-facing staff at these branches. These training sessions will count toward professional development credit. Social work is not work that comes naturally. It requires a working knowledge of the nuances and systemic structures that contribute to wealth divide, discrimination, mental illness exacerbation, stress coping mechanisms, developmental challenges these stressors cause, as well as the ability to know how and when to establish and maintain boundaries for the social worker themselves to avoid burnout and compassion fatigue. Libraries are refuges for the unhoused, especially during inclement weather conditions. And as a field whose modern ethics call for equitable access for all in the community, we want to help those who come through our doors. Having trained social workers can help fill that knowledge gap by directly providing social service to patrons. But as seen in the studies quoted here, even having social work interns included in a library can help the rest of the library staff, quote, meet the needs and develop community responsive programs. They can also educate library staff about social work concepts, empathy, and homelessness. As Leah Square, a social worker who helped begin the growing movement toward integrating professional social workers into library staff at the San Francisco Public Library in the early part of the century, explains, by forging our services and resources together, we are stronger together, and more people experiencing homelessness will receive the help that they need within the safety of the library. As a library, we can provide our patrons with their informational needs while combining forces with a trained social worker to help connect our patrons with the actual resources needed to help themselves. Of course, this is not a program we can just pull out of thin air. If we want to provide our patrons with the services they need, we will need to provide competitive pay and benefits for the person who joins our team. We will need to work with Community Partnership of the Ozarks and potentially other homelessness advocacy groups to produce funds for a total budget annually of a combined salary and benefits of just under $76,000. We will be asking a lot of one person, and it is important that this person is fairly compensated for their time and expertise. It is a lot to take on, yes, but if we want to serve our community according to our own library's mission and values, we need to work together to attract and support our new social services coordinator. Thank you for taking the time to listen today. I would encourage you to check out the following references, which provide a whole lot more information about other programs that have integrated social work into their libraries for a bit more background on just how big of a benefit it would be for us. Thank you and have a great day.